But you don't have to do it now. You can start reading.
Bum, 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 ba-dum, bum, 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 ba-da-da-dum, bum, bum, ba-bum, ba-da-dum-dum. Bum, 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 ba-dum, bum, 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 bum. Da 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 dun 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 da 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 dun dun. Hi, how are you? You're all looking good. I see all my friends from Mighty's. It's so wonderful from all over the globe. Well, mostly the US, San Diego, Texas, Nebraska, South Florida, Boca. Hi, Sue. Hello from Boca. I'm pretty close to you. Tampa, San Antonio, another Tampa, and Portland. And this has just started. So we are I don't see my friends from Facebook quite yet, but I will. So, wow, it's so nice. The day after Independence Day. Don't we love it? Independence Day. It's such a cool thing. Okay, let me line up my Facebook people and we can get started. So, if you're new here and you don't know me, I'm Joette Calabrese, homeopath for over 3 decades. Actually, I was counting the other day. It's about 34 years ago that I started studying. I'm a mom who raised her now adult children using only homeopathy. Truly, we used only homeopathy, maybe and botanicals, and some good quality foods, nutrient dense, Weston A. Price Foundation type foods, and guts, spunk, and moxie. And so I'm your teacher. I love being your teacher. I love seeing everyone coming in. Thank you, folks. Really, thank you, friends, for being here. It is really a privilege, and I mean that, a privilege to be your teacher. I can't tell you how heartwarming it is to see not only you here tonight as you come in. There's Sheila from Jupiter and Kathy from Maryland. I just love it. And then I see the responses and the numbers of people that follow through. You know, we have 6,000-7,000 people who watch each one of these each week. It's just heartwarming. So my guess is that you're here because you love homeopathy, or you're just learning about homeopathy and you're learning to love it. And I know that if you're new to this, trust me, you are in for the ride of your life. Look, I know the promises that come with other medical paradigms, but this is the end of the line, folks. This is the trump card. This is the cadence. This is after going circuitously through essential oils, and not that there's anything wrong with them, and synthetic vitamins don't like, and botanicals love, and chiropractic love, but having to wade through all of the allopathic drugs that you've been convinced to be put on, and then we finally, and good nutrition, and then we finally find, oh, homeopathy, home again, home again. So I know that you want inside information, and I love sharing it. I give inside information on these Monday nights Facebook Lives, but I give just a little more and a little more about me and about my life and how it's affected me, how homeopathy has affected me, what it has done for my family and me in my Mighties. So should you be interested, you can also consider joining Mighties. But if not, and you want to stay on this level, for those of you who are Facebook Livers, then by all means, just stay there. It's fine with me. We want to celebrate, though. We want to celebrate that you are learning this, that I am still learning. Do you know that what I've been doing for the last, I'm going to say 4 hours this afternoon, is I am studying Dr. Samuel Hahnemann's Organon. I did it many years ago in order to pass my exam that I took, and also in order to feel confident and competent in homeopathy. But now I'm reading it again, and it's fascinating. And as part of my academy, which is we're putting together now, we're developing, which will launch this September, I'm going to be, it's another reason I'm studying the Organon, because I want to be able to teach it in the best way that I know how, so that those who are interested in not only using practical homeopathy, but understanding the underpinnings upon which this beautiful medicine, this elegant medicine, this polite medicine is based. All righty. So tonight we're going to be talking about something that plagues a lot of people, mostly women, but men too. And it's fascinating because the first medicine I always think of for urinary tract infection is cantharis. And I've written about it. It's on my blog. You'll find information on it. Cantharis, Cantharis. I usually start with the 30. I'm going to whip through this because I want to get to the medicine at hand tonight. But I want to give you some ideas. Go to my blog. If urinary tract infections are something you want to learn about, by all means, you just Joette Calabrese urinary tract infection. Or you don't even have to go to the blog because I have written about urinary tract infections and many other conditions for Wise Traditions, which is the journal. I had a column in that journal for 11 years, and I've written for many other bloggers. And so you'll find lots of information that you might not even find on my own blog. So the medicine I want to talk about tonight is Sarsaparilla, not Sarsaparilla. I've heard it pronounced all different ways. It's S-A-R, sap, S-A-P. It's just the way it sounds. A-R, illa, I-L-L-A. It's officinalis, Sarsaparilla officinalis. Officinalis means that, that's the second word, and it's the official Sarsaparilla of sorts. I suppose that's a way of putting it. It's the Sarsaparilla root, and it's a really great medicine for urinary tract infections. Now, a lot of people say, well, what about my kidneys? Well, the kidneys are part of the urinary tract. Okay. So when I give you an overview of what we're using this medicine for, or any medicine for that matter, I want you to know more than just what you think you know. So go online and say, are the kidneys part of the urinary tract? You need to know that so that you don't waste time wondering that and maybe making a poor decision. I want you to make a good decision based on information that you have as your baseline. All right. Let's get into this. All right. Symptoms that indicate, I'm going to read from I should tell you, you should know this. This is my Materia Medica. I urge folks to consider purchasing it if you don't already have it. If you don't have it, no problem. I'm going through it. We are already in the S's. It's taken quite a while because we took a break for several months on and off so that I could teach you other issues that were at hand in 2020, of course. So Sarsaparilla. Symptoms that indicate, I'm reading from my book, a need for the remedy include severe pain. Here's the key, at the end of urination. Now, what if that doesn't happen? What if it turns out that you only have pain at the beginning of urination? Well, let's read further to see what else might be indicated, okay? Dribbling urine when sitting, okay? And pain from the right kidney downward. The urine may contain blood, white sand, or a gravel-like precipitate. So how will you know if there's gravel? Well, if you've got a urinary tract infection, I urge you to actually urinate in through a cheesecloth or some kind of a cloth. And given that we want to see white sand, you wouldn't want to use something white. You might want to use something that's colored, like a red handkerchief or something like that. That's how you might know. Another way to know is to urinate in a clear glass jug, and then once the urine settles, after a while, you can hold the jug up to water or to the light, and you'll be able to see. So you do want to know that. So do we need to have pain only at severe pain at the end of urination? No, listen to all the symptoms we've got. We don't need to line up every one of those symptoms in order to choose this medicine, or any medicine for that matter. We do not need all of them. In fact, it's highly unlikely that you'll ever see all of them put together, because in our Materia Medicas, there are consolidation of hundreds, if not thousands, even if in some cases, tens of thousands of people in which the information has been gathered. In the very beginning, it was just hundreds, and most likely that's what it is. But if you add in the clinical experience of many of the homeopaths, the medical doctors through the last 2.5 centuries who have contributed to Materia Medicas, and you add all of their patients as well as the provings, now we're getting into many thousands of people whose information we've got as a template for how this medicine acts. All righty. So again, let me just reiterate: you do not need all of these conditions in order to choose this medicine. It might be one or two. It might also be, and I'll give you some other criteria from which to consider this. It might also be that you've already used cantharis, which is one of my favorites. It's one of the first ones we choose. It's not always, but in about 80 to 85% of those people who are suffering from a urinary tract infection, cantharis 30 is generally the one that acts. Doesn't mean it's the only one. It's generally the one that acts. If that doesn't act, then we might go to cantharis 200. And if that still doesn't act, then we're going to consider going to, for example, Sarsaparilla. And that's how we navigate this. Don't expect that because I've told you that this medicine is for this condition, that is it, and that's the end of it. If it doesn't work, homeopathy doesn't work. I can't tell you. I hope that those of you who have owned a repertory, or those of you who've been studying for a while, understand. And those who are new, let me explain that there are many, many medicines for one condition. There are many medicines for eczema. There are many homeopathic medicines for neuropathy. There are many homeopathic medicines for irritable bowel syndrome. There are many homeopathic medicines for urinary tract infections. What I like to teach is the most practical aspect of homeopathy and teach you those medicines that stand out and become the most obvious, the most prominent medicines that we know have worked most readily for the largest number of people. So if it doesn't act for you, oh, nay, nay, do not give up. I want you to go to the next medicine. Alrighty, I'll continue reading. Those who experience spontaneous trickling of urine when in a seated position will most likely only experience normal urine flow when in a standing position, so that they have to stand often in order for it to flow properly. The urinary bladder is distended, causing immense pain and tenderness in the entire region. Think of this medicine for urinary tract infections that are not improved with cantharis. It is usually used in a 30th potency. What does that mean? We're using Sarsaparilla 30C. If you're in a place in the world where you can only get 30X, then that's your medicine. But 30C is the most widely used these days. And is taken every 3 to 6 hours until the infection has ceased. How long does it take? People often ask me, well, I don't know how long it'll take for you, but we normally see a shift after using it in the beginning for a while within the first day. And usually by the end of 12 hours, the person's shoulders can be dropped down and they can start relaxing a little bit. And indeed, the symptoms may still present. However, it's not as though it's, I want to just recharge this again. If the symptom, I just lost my train of thought, so please excuse me. It's because I want to get Facebook. I want to see my Facebook questions, and they weren't showing because I'm going to want to answer them. There we go. It's live again. All righty. So where was I? Oh, frequency. So if we use it in this fashion, we use it every few hours, etc., and the symptoms become less intense. These are my 3 magic markers. Less intense, the symptoms are, lasting for a shorter period of time. In other words, the pain is not so long. The pain is a little bit less intense, and a larger space between each episode. In other words, it's not happening as frequently. Then we know that we're onto the right medicine. And we also know that we're onto the right medicine, not only with Sarsaparilla or cantharis or any other medicine for that matter, is because we see other conditions kind of softening. Oh, I'm not as anxious anymore. Or, oh, I don't feel as frenzied. Or I'm not as weak. I'm not as, I don't have to urinate as frequently. It doesn't even have to have anything to do with urination. I feel a little lighter. I don't feel as heavy in the area of the bladder, the kidneys, the ureter, the urethra. All right. So sarsaparilla is especially great for some women may experience it in an itching eruption in their forehead during their menstrual periods. Now, is that not interesting? Other related symptoms include dysmenorrhea, or painful menstruation marked by pain in the lower back, tender breasts, nausea, vomiting, and diarrhea. Now, look, Sarsaparilla has many indications, many conditions it can work with, it can aid with. But I'm reading this about menses because it's particularly important, because a lot of times the menses is related to the urinary tract. All righty. So Sarsaparilla is also beneficial for people suffering from rheumatic aches. Interesting, isn't it? That tend to feel worse in humid, moist weather and at night. So, what if the person is feeling this urinary tract infection and it's the weather is hot and humid right now? That's the way it is in Florida. And they feel achy, and they're thinking, oh my gosh, this infection is really getting to me. I'm getting achy and I'm getting worse. And and they're not making the association between them all. But now I'm going to pull it together so that you can consider that association. So not only are we choosing this medicine based on the name of the condition, urinary tract infection, we're also looking at all the symptoms that could be related in this person, so that we are using essentially the totality of symptoms. So you see that I'm studying the organon more, and I'm using the verbiage from Dr. Samuel Hahnemann. But we do want always to look at symptoms as well as the condition. So the condition, if it's a three-legged stool, we're going to use one leg as the condition, the other leg would be the symptoms, and the third leg would be another symptom, but noteworthy symptoms. So if you see a rheumatic type sensation in this person, and they also have that pain, especially after urination, et cetera, then we know we've probably got a good remedy choice. All righty. There's more to talk about here, but let me read some of your comments, folks. Let's go back up. Was sitting on the patio yesterday folding my tinfoil hat. That's Harry. And Harry, you're funny. Hello. I think I went too early. Let's get those that are related to tonight's discussion. Happy Independence Day. Yes, you bet. All righty. It's wonderful to see Portland, Oregon, and Baghdad, Kentucky. I did not know there was a Baghdad in Kentucky. South Windsor, Connecticut, Plant City, Florida, Alberta, Canada, Hamilton, as I always said. Can't wait to get back up there again. I can't wait. Hello from Ontario again. You've got somebody really mighty in Ontario. Check out Amazing Polly. She's in Ontario. I follow Amazing Polly. For anyone who's interested, you don't have to be from Ontario to enjoy Amazing Polly. She's on Rumble, etc. Very, very bright woman. Newberry, Ohio. Wonderful. Albuquerque. Hello, fellow mighty, says Francine, Ohio. The mightiest. Yes, it's on mightiest. Jupiter, Florida. All right, let's see where folks are coming from on Facebook. A couple of years ago, says Sue, I had a UTI caused by Protus mirabilis, treated with several homeopathic remedies, but after a few months, found out I had staghorn. I was jumping all around. Oh, my goodness sakes. I can't read it. Where did it go? See, that's the problem with Facebook. It jumps all around. I don't know where it is. Yes, please, if you don't mind, I want to be able to finish reading that. Yeah, I did. Let me just.
Double clicked on the video.
Yeah.
Go down.
Yeah.
Right there.
Yeah. Yeah. Okay. Let's.
Go.
Yeah. The
Says
problem
so.
is that I want to be able to read something that someone wrote here, because it looks pertinent. I may come to it. Shoulder pain, nerve pain, shoulders. Okay. Somebody's talking about using hypericum and symphytum. You bet. Very good. Let's see if I can find that one. Okay, I found, says Alicia, this is something different, that Sarsaparilla 30C is part of the Banerjee protocol for renal stones. What do you know? Urinary tract, isn't it? And we used it along with berberis for my daughter. It helped greatly. She hasn't had a kidney infection for many, many months, And I think the Banerjee protocol helped clear her. Yes, you bet. Of course it did. Of course it did. Don't assume, listen, folks, nature can do good. Drugs do damage. Homeopathy does great good. All right, let's see what else we've got here. Here it is. Okay, from Sue. A couple of years ago, I had a UTI caused by, I think she's talking about specific micro or macroorganisms, treated with several homeopathic remedies, but after a few months, found out I had a Staghorn kidney stone filling almost whole left kidney. Would have been more specific for homeo remedy. Would there have been? Yes, there is a more specific. And that's why I urge you to go to my my blog. I've talked about it. I've taught it. So by all means, check that out. Look under kidney stones. I see others had trouble getting on. Okay. But we're doing all right tonight. We are doing all right. Janie, very nice. Sarsaparilla was excellent for a family member. Janie's from England, but now she's in Canada. Visiting, I think. Yes, was excellent for a family member with a kidney stone as part of the Banerjee protocol. You bet. Fell in love with the order of homeopathy many years ago, says Donna. Love that God has not left us alone here with nothing to help others. Paraphrase from Dr. Hahnemann. You've got it. This medicine is God's medicine. How do we know that? It's not medicine of industry. It's not synthetic. It's not owned. You can't own Sarsaparilla. A manufacturing pharmacy cannot own it. All that a manufacturing pharmacy does is get the plant and dilute it and succuss it and dilute it and succuss it. That's all they're doing. They cannot own a patent on it. Hence, these medicines, I don't have one in front of me. I should. I'm not taking any. That's why. These medicines, here's one. These medicines cost $15 instead of $1,500 or $15,000. I've got one. Thanks, honey. I've got it. All right. Fell in love with, let's see. Diane, let's see. Is homeopathy effective on UTIs previously treated with antibiotics? Well, let me ask, that's Astrid is asking that question. Does anyone know anyone who's not been treated with antibiotics? Unless you're a Christian Scientist or you're a young person with parents who made it their point of not using any drugs. Everyone has been treated with antibiotics, whether they were used for antibiotics for a strep throat, otitis media, conjunctivitis, a UTI. It does not matter. Don't think for a minute that you have to be pure in order for homeopathy to act. Don't think that for a minute. We all come to the table with a history of drugs. It's the world in which we've lived. Now we're turning the corner, aren't we? You're coming with me. We're all going together, linking arms across the earth, and we are turning the corner together. We have had it up to our eustachian tubes with these chemical drugs. We've had it up to here with what do I say? Conventional synthetic drugs. Now, I am not telling you that if you're on a drug that you need to get off of it. I would never say that. I'm not a medical doctor, and I make that clear time and again. If you're on medical drugs, then you must judiciously get off of them with that aid of your doctor or pharmacist. Perhaps using homeopathy on the side, but you're going to use your doctor or pharmacist if you're going to get off, because there could be a boomerang effect or any other effect that could be quite sobering. However, if you're not already taking meds, or your children have not had meds, or they've had them in the past, do whatever you can to treat your family with this medicine. Learn as much as you can. I want you to build your arsenal. I want you to build your arsenal of information and knowledge on how to use this, how to manage a case, how often to use a medicine, what potency, what frequency. I give you that. And then I want you to know, now we stop using it. The infection is down. The person is calmer. There's no more pain. The dribbling is over with. Okay. All right. We can stop. Now let's say 3 days later, oh my gosh, it's back again. Don't say, oh no, it's back again. Instead say, oh yay. Here's an opportunity to use a medicine that uproots conditions. Here's an opportunity to get to the bottom of the condition and put it to rest. It may have not been put to rest this particular time. or maybe even the next time. But you're going to see, again, 3 magic markers: less intensity to the symptoms, whatever symptoms it is we're measuring, lasting for a shorter period of time, and a larger space between each episode. So for someone who's had frequent urinations, let's say every month or two, now we want to see the next urinary tract infection maybe in 2 months. Okay, that's the outer end of the time that which she normally gets it, or a man gets urinary tract infections as well. Then it's treated homeopathically, and then now maybe we can stretch it out to, instead of 2 months, 4 months. And then let's say that next one that comes in 4 months from then, now the intensity is even less. The pain is not so great. Or let's say it's still just as great. No matter. We want to get one of those 3 magic markers in there. If we can get all 3, we've got a dead ringer. Now we use the medicines again until the condition subsides. Okay, the person feels well. Okay, they're back onto their tasks of the day. They can get moving again. Now the next urinary tract infection doesn't come for another year. Gorgeous. Look, if we could get someone who gets urinary tract infections every other month to get a urinary tract infection every 5 years, and they're already 70, beautiful. Without antibiotics, without all the extreme suffering, because we can get it down. So what I'm giving you a hint at is, more often than not, when it's an acute condition, we can get rid of it. We can. You can do this. But sometimes it's so old. And as Ingrid said, or Astrid said, it certainly can. What if I've already taken antibiotics? It might slow the progress down a little bit, but not much. Not much. And so what we're looking for is the body's, in other words, don't be too impatient. Just let the disease roll off your back. Use the homeopathic medicines. Contact your friends that you know that if you're in study groups, and you should be in a study group, folks. If you're not, you should join one of my Gateway to Homeopathy groups. That's where you learn. That's how you share. That's how they share. And they're very inexpensive. So if you don't know how to do that, just go to my website and look at Gateway to Homeopathy and join one. Okay. My sister has severe nerve issues after being treated repeatedly with Cipro for UTIs. Breaks my heart. I didn't know all of this years ago. So important. You bet, Kate. Super important. A lot can still be done. Do you typically use Sarsaparilla when Cantharis doesn't work, or as an ancillary in the keynotes? No. Wait a minute, hold on. It just jumped around. It's so hard to watch this because it just leaps. I would use, if there were strong enough indications of Sarsaparilla, I might skip over Cantharis. If you have a materia medica and you know your medicines and you could compare Cantharis to Sarsaparilla, I might jump to Sarsaparilla. There's no doubt. I might also consider, by the way, Staphylococcus aureus, which is another great medicine for this. So is Thuya. So I want you to look. You see all of the choices that you've got here. I'm trying to give them to you in order. Cantharis 30 usually. Cantharis 200 if that doesn't work. And you've got to give it its due. You've got to give it at least a day or two, or unless the pain is very extreme or there's a fever. You've got to give it some time to see some shift into improvement. All right. Let's see. I so love it. God is good. You've got that right, Mary. How do you teach a friend another better way to treat her frequent UTI? She has only used antibiotics and clearly it is not working and it keeps coming back. Have her come to this. This will be up tonight. Have her watch me. And then have her go to the blog. Instead of learning from you, it's nice to have friends and family learn directly from me. Let me be the bad guys. You bet. You bet, Mary. Antibiotics. Could get antibiotics indirectly even in our animal products. Yes, you can. Yes, you can get into antibiotics indirectly from animal products. And you bet, Max. That's why it's important to get grass-fed, organic, even organic. Got to be careful with that word. You got to go a few steps further. Know your farmer. I know 5 people who have never used antibiotics. They had a very wise pharmacist dad. Isn't that interesting, Janie? Pharmacist got it. The dad got it. Yep. Yeah. All right. Let's see if we've got any other questions. It's not too late. I used antibiotics for many years, says Brenda, for UTIs, but after switching to homeopathy, I've uprooted them. I have not had one for at least a year. Good job, Brenda. Good job. You know, it also matters what you eat. You know, some people are very sensitive to certain foods. So I'm not saying I don't want you to go on a diet and live a life of abstinence. I want you to use homeopathy and eat your good foods. But sometimes even good foods for some people can be a problem, and you may need to switch a little bit should there be no change with the or not enough change or fast enough. Okay. You know, another remedy, I just saw somebody talking about apis. Apis is another good medicine for very stinging pain for urinary tract infection. I found that Sarsaparilla is part of the Banerjee protocol. There, we got that already. Let's see. Liberty Veritas. Yes, I do use Metarainum too. Shoulder pain, nerve pain. Okay, I don't want to go into other conditions, but I promise we'll get to all of those. And you can look them up on my blog. I have lots of information about shoulder pain and tendons and muscles. All righty. I think we have got it, my dear friends. Yep, I think we've got many other comments. I love reading them, and I'll read them tonight after we're finished. But I have to dash off. It is now 8:31 Eastern Standard Time, and I want to thank you for all being here. And please pass this along to your friends. It's free. I'm not trying to sell anything. As I've said, if you want to get my Materia Medica, of course you get it. But there are many different Materia Medicas. Mine is very small. Mine is just a simple Materia Medica. You can get much more in-depth knowledge owning many Materia Medicas. And so for that reason, I say, I love you all. God bless all of you. And good night. I'll see you next Monday at Eastern Standard Time, 8 o'clock p.m. Bye, folks.